Hey everyone, welcome back to Corporate Decoder. Today we are diving into a report from NewAmsterdam Pharma, and let me tell you, it involves Alzheimer's, a condition that I'm sure none of us want to forget about. But the company is claiming to make progress on boy, and before we get started, if you're into getting straight to the point insights from company reports, subscribe to our channel. Also, join our Discord community. The link is in the description below where we can discuss these reports further. In this report, NewAmsterdam Pharma is sharing some exciting news from their clinical trial. They've been studying a drug and it looks like it's having a positive effect on certain signs of Alzheimer's disease in the blood. This could be a big step forward in understanding and treating this terrible condition. Let's break down what they found and what it could mean. This report is called an 8K, and it's basically a company saying, hey, we have some important news we need to share with our investors right away. This particular report is dated June 9, 2025, so what's the big news? The main point of this report is to share some positive information about a clinical trial. The company is calling this the Broadway Pivotal Phase 3 clinical trial, and it focuses on Alzheimer's disease, which is a brain disorder that slowly destroys memory and thinking skills. They found some positive data. It means the drug they were testing may be helping to slow down the disease. To get all the details, the company included a press release as Exhibit 99.1. Think of this press release as a written announcement to the public sharing the key findings of their research. NewAmsterdam Pharma shared the tapline, the most important data from a sub-study span within the Broadway clinical trial. This sub-studies span looked at how their drug obicetrapib affects certain substances in the blood that are linked to Alzheimer's. They paid special attention to people who carry the UPI4 genes, which means they have a higher risk of getting Alzheimer's. One of the main things they measured was SPAT-PTOR27. Think of it as a specific marker that indicates the development and progression of Alzheimer's. The company measured the changes in HESPAN-TOR217 over 12 months, meaning a full year. Here is the exciting part. The company saw statistically significant lower absolute changes, meaning that this marker did not change as much in the people taking obicetrapib on 7, compared to the people taking the placebo, which is a sugar pill with no medicinal benefit. This was the case in both the full study population and in APOE4 carriers. This is important because it suggests that the drug might be having a real impact on the disease process. The company wants to be upfront about what they can guarantee, so they included what's called forward-looking statements. It's basically them saying, hey, we're excited about these results, but there are no guarantees about the future. They point out that all these statements rely on assumptions and reality might be different. The forward-looking statements mention many risks. For example, regulatory approval for their product is not guaranteed and might take longer than expected. The initial positive results they are talking about might not hold up when all the data is in. Also, they may face tough competition from other companies, and there is always a risk they might not be able to get enough raw materials or keep their key people, and they mention that those issues could make actual results differ from what they anticipate. Lastly, the company included a list of exhibits, including the press release that has all the details we discussed. Acted now, putting everything together, what does this mean for NewAmsterdam Pharma? On the positive side, the company has some promising results from its Alzheimer's expansive study. The fact that the drug showed a positive effect on a key marker of Alzheimer's, especially in high-risk individuals, is definitely encouraging. This could potentially lead to a significant breakthrough in the treatment of this disease. However, it's important to remember the company's own warnings. Clinical trials are unpredictable, and there's no guarantee that these initial findings will translate into a successful product. Regulatory approvals are a long and complex process, and competition in the pharmaceutical industry is fierce. One thing that I will point out is that the company is not very profitable and doesn't have much revenue at the moment, which means that this news is a major milestone for the company. The results that they are showcasing in this 8K will impact them much more than a larger pharmaceutical company. In conclusion, NewAmsterdam Pharma has presented some promising data in this report, but it's crucial to approach it with cautious optimism. The company faces a number of challenges, and its success will depend on navigating these hurdles effectively. What do you think about NewAmsterdam Pharma's progress and prospects? What would you do if you held shares in the company? Share your thoughts in the comments below. If you found this analysis valuable, please give us a like and subscribe for more deep dives into corporate filings. Don't forget to check out our Discord community. The link is in the description. Thanks for watching and see you next time.